It does matter. Um, it is interesting how family dynamics and culture go together and how they include their family in medical decisions. Some cultures want to stay independent and not burden their family with their medical problems or ask for help from their family or involve their family in getting assistance with their medical problems. And other cultures are very family oriented, where they would like their children or their parents involved. And you have to realize that as a physician, because one of our jobs is to look for obstacles in this patient achieving their full potential of health, and knowing if they have a community or a family that they rely upon or are comfortable working with is, I believe, gets you the best outcome. However, if it's a culture that does not rely upon that, can make these obstacles harder to overcome, but you have to be respectful of the patient and their wishes and see what they are comfortable with, and sometimes letting them choose not to rely on their family.
One of the things I try to do is talk with the interpreters first, and I get from the interpreters a lot of information about culture, family, medication, who is the go-to person in their community. So I try to gather as much information as I can prior to the interview, so that will help me understand what's going on, also help me pass that information on to the physicians or the medical students or whomever. And sometimes I'll document that in the chart sometimes, so we'll all be on like the same page. So I think that's real important as far as teamwork.
Okay, we have a lot of friends. First of all, the system. That's what we are trying to do. No? As you said, not the language barrier, is the system. System over here is totally different system back home. Back home, the internist, when he will have a patient, he will solve all of the problem from A to Z. That's what my patient expects when they come over here. They are coming to the doctor. Okay, she has problem with her eyes. The doctor over here, he will say, we need to refer you to eye clinic. This is when the patient is mad after all of that waiting. And there is also culture and religion differential. For our patient, the women, they prefer to be seen by a woman doctor. And thank God, women make that very easy. They give them the choice and they schedule with the women doctors. And also the questionnaire, when the patient will come, and that's what we educate our patient, that the question they are asked, it's a general question. It is not because of you. And one of those questions, do you smoke? Do you drink? Do you take a drug? They feel at the beginning it's very insulting question. Why they asking me this question? So we are trying, to smooth everything up and do everything we need to do to make the patient feel comfortable here, and he is not there to be asked, very sensitive question. That's question for everyone. So yes, I think everybody deserves to have an interpreter to communicate with the doctor and their needs so they can get better care.
So one of the ways that that culture affects my clinical practice of medicine is kind of understanding that some topics are going to be more taboo with different cultures, which is why it's really important to explain specific questions you're asking and why they're pertinent, as well as any sort of physical exam you want to do on a patient, so they understand where you're coming from and the necessity of it.
Yeah, and acknowledging the full context of where patients come from is what allows us to provide better care.
So when I was a floor nurse, I never always knew that person's religion or their culture. So I remember one death that we experienced, me and another colleague, and it was my colleague's patient, but they had passed away, and so my colleague opened the window, and that's whenever I was introduced to the fact that some cultures believe that the spirit rises and they need an exit. So they opened the window, and from there out, I never assumed the religion or the culture of a person. I always just would open a window if we were able to, open the door, close the curtain so that the body would still be not visible, but yet in some cultures it would have a way out.
So I think for me specifically, when I see kind of different cultures impacting patient care the most is being a male, and I see a female that is Muslim and doesn't usually have contact with male physicians or obviously med students. One time I was talking to, or I asked the female, I was like, oh, do you feel comfortable with me listening to your heart and lungs? Because I know making contact, there's different practices and different cultures and norms about that. And she said that it was okay because I was I was in the medical field, and so that was allowed. But I still feel, I still felt uncomfortable to an extent doing it because, it being a student, I didn't feel it was completely necessary for me to do so. And the regular physician, I think it was a female at the time, could have done that without me intervening. So I definitely think it's important. I think it's important to get the patient's opinions about how they want me to treat them or how they want, how their goals of care are, and then to base your treatment around what they really want, because you don't know until you ask.
I think I see, like with culture in clinic, when you meet with different patients, if they come from a different cultural background, they might have different terminology for different things, and I think that it's important to understand what they're talking about so you can communicate effectively.
I think one of the most important things in dealing with difference in culture in the medical field is respect, and making sure that you're showing the most respect to your patient and giving them the respect of what they want in their patient care, and making sure that you're not crossing boundaries that they're not comfortable with, and making sure that if you approach a patient, you say, is it okay if I listen to your heart and lungs? Is it okay if I examine your neck? To make sure that they know what's going on so they don't just see you coming at them, and that they give you